Today we are going to talk about the 10 most dangerous non-communicable diseases in the world. Did you know that heart disease, stroke, and respiratory infections account for the majority of deaths worldwide every year? Certain preventative measures can help greatly reduce your risk. When people think of the world's deadliest diseases, their minds may jump to fast-acting, incurable diseases. However, 55.4 million deaths occurred worldwide in 2019. And 74% of these deaths were reported to be from non-communicable diseases, or slow-growing diseases and chronic conditions. Did you know that some deadly diseases can be partially prevented? We invite you to stay with the video to know about it. So let's go to the video. Number 10. Cirrhosis. Cirrhosis is chronic or long-term scarring and damage to the liver. The damage may be the result of kidney disease, or it may be caused by conditions such as hepatitis, alcoholic liver disease, or non-alcoholic fatty liver disease. Chronic alcohol use, accumulation of fat around the liver. Non-alcoholic fatty liver disease, chronic viral hepatitis. Minimizing alcohol consumption can help prevent liver damage and cirrhosis. Likewise, you can avoid reliable sources of non-alcoholic fatty liver disease by enjoying a nutritious diet rich in fruits and vegetables and low in sugar and fat. Finally, you can reduce your chances of contracting viral hepatitis by using barrier methods every time you have sex, and by not sharing anything with traces of blood, such as needles, razors, or toothbrushes. Number 9. Tuberculosis. Tuberculosis is a lung condition caused by the bacterium Mycobacterium tuberculosis. It is an airborne bacterium that can be treated, although some strains are resistant to conventional treatments. Tuberculosis is the leading cause of death in HIV-infected people. Impact of tuberculosis worldwide. Between 2015 and 2020, 2% of patients with this disease have been reported. One of the goals of the United Nations Sustainable Development Goals is to end the tuberculosis epidemic by 2030. The best prevention against this disease is the availability of the Bacillus Calmette-Guerin vaccine for infants and children in areas where tuberculosis is prevalent. If you think you have been exposed to tuberculosis bacteria, see a doctor right away and get treatment for the disease. Number 8. Dehydration due to diarrhea. Diarrhea is when you pass loose stools 3 or more times a day. If your diarrhea lasts more than a few days, your body is losing too much water and salt. This leads to dehydration, which can be fatal in severe cases. Diarrhea is usually caused by intestinal viruses or bacteria transmitted through contaminated water or food. It is especially widespread in areas with poor sanitation. Diarrhea is the second leading cause of death in children under 5 years of age. About 525,000 children die each year from diarrheal diseases. The best way to prevent this disease is to practice good hygiene, wash your hands, drink boiled water, and seek medical attention quickly. Number 7. Alzheimer's disease and other dementias. 55 million people worldwide are living with Alzheimer's and other dementias. Alzheimer's disease is a degenerative brain disease and the most common form of dementia. Dementia is not a specific disease. It is an overall term that describes a set of symptoms. Memory loss that disrupts daily life can be a symptom of Alzheimer's or other dementias. Alzheimer's is a brain disease that slows down memory, thinking, and reasoning skills. Here are 10 warning signs and symptoms. If you see any of them, don't ignore them. Consult your doctor immediately. Number 6. Diabetes mellitus. Diabetes is a group of diseases that affect the production or use of insulin. Effects of diabetes worldwide. If left unchecked over time, complications such as nerve and blood vessel damage, disability, non-healing wounds, kidney failure, and blindness can occur, and even death if left untreated or under control. Being overweight or obese, high blood pressure, old age. Not exercising regularly, people who eat unhealthy food have a tendency to develop this disease. Although the disease is not always preventable, you can control the severity of symptoms by exercising regularly and following a well-nourished diet. Number 5. Lung cancer. Lung cancer is a type of cancer that starts in the lungs. Your lungs are 2 spongy organs in your chest that take in oxygen when you inhale and release carbon dioxide when you exhale. People who smoke have a higher risk of developing lung cancer, but lung cancer can also occur in people who have never smoked. The risk of lung cancer increases with the length of time you have smoked and the number of cigarettes. If you stop smoking, even after years of smoking, you can significantly reduce the risk of lung cancer, and remember that this disease is a deadly disease. Number 4. Obstructive pulmonary disease. Chronic obstructive pulmonary disease, COPD, is a long-term, progressive lung disease that makes breathing difficult, including inhalant bronchitis and emphysema. In 2018, 16.4 million people in the United States were diagnosed with chronic obstructive pulmonary disease, COPD. This disease is caused by respiratory disorders in infancy, inhalation of chemical fumes, and excessive smoking. To get rid of this condition, you should avoid smoking and wear a face mask to avoid inhaling chemical fumes and get treatment immediately if you have symptoms of COPD. Number 3. Lower respiratory infections. A lower respiratory tract infection is an infection of your airways and lungs that can cause difficulty breathing. Influenza or flu, pneumonia, bronchitis, tuberculosis, TB. Although viruses usually cause lower respiratory infections, they can also be caused by bacteria. The main symptom of lower respiratory infections is cough. It may produce bloody sputum. You may also have a fever, sweats or chills, or shortness of breath, and a tight feeling in your chest. This disease is caused by poor air quality, frequent smoking. Factors like having a weak immune system are more prone to this disease. One of the best preventative measures you can take against lower respiratory infections is to get the flu shot every year. Be sure to wash your hands regularly with soap and water, especially before eating, to avoid passing on bacteria. If you have a respiratory infection, stay home until you feel better, as rest improves healing. Number 2. Stroke. A stroke occurs when an artery in your brain becomes blocked or leaky. This causes brain cells to die within minutes without oxygen. Symptoms include sudden numbness and confusion, or difficulty walking and seeing. If not treated within 3 hours of the condition, a stroke can lead to long-term disability. You can avoid this disease by quitting smoking or drinking in moderation, controlling high blood pressure with medication, maintaining a healthy lifestyle, exercising regularly, and eating a balanced diet low in sodium. Number 1. Heart disease or coronary artery disease. Coronary artery disease is the deadliest disease in the world. CAD, also known as heart failure, is a narrowing of the blood vessels that supply blood to the heart. If left untreated, CAD can cause chest pain, heart failure, and arrhythmias. Impact of CAD around the world. Although it is still the leading cause of death, the death rate has decreased in many European countries and the United States. However, the mortality rate for CAD is increasing in many developing countries. Especially this situation has to be faced. High blood pressure, high cholesterol who smokes diabetes, for those who are overweight. If you have one or more of these risk factors, talk to a doctor or healthcare professional. You can prevent CAD with medications and taking steps to improve heart health. Engage in daily exercise that can reduce your risk.